Welcome, everybody, and thanks so much for signing off on the form so we could videotape this. We are very excited today because we are launching an exciting initiative, kind of a new next step. And you are all part of that. We call ourselves the New Council of Community Leaders. And many of the old council. That's right. Today it's the new council. Many of you were actually part of the discussions that led us up to this step. If you weren't, if I could just recap briefly, we devoted over a year and multiple meetings to consider how to effectively structure ourselves, recognizing that the world has changed since the Federation was birthed. We knew that we needed to do a touch base. And so over the course of those meetings and opportunities to discuss, members told us what they valued most was the discussions about cross-cutting issues that affected all of us. Yet our former structure of meetings and meeting times didn't allow enough time for those kinds of discussions. We also realized that we had 38 members responsible for governance of an organization with 19 staff. And that wasn't an efficient use of the brain power that is around the tables today. So in practice, we actually delegated most of the actual governance of the executive committee. And then we came to you and said, let's just formalize. Oh no, then that's part of this model is we decided just to formalize what we were doing in the real world. We also looked at how other organizations like the Federation were structured, and incredibly, we found that we are unique and found none to imitate. So we decided to set up 3 co-equal bodies, each with an important and specialized function. The first body is the fact that the board appoints a nominating committee, which selects the council of leaders, the new council of leaders, which elects the board. I think this structure makes the most of the leadership we have in DuPage County. And since we are pleased that several of you are joining us for the first time today, I thought it would be great if we could go around the room and do some introductions. So if we could start with table red.
My name is David Ware. I'm with DuPage AME Church and Reach Foundation.
My name is Steve Swanson. I'm a Lutheran pastor, and now I'm serving a church in Carroll Street.
Carolina Duque, I'm with the Federation.
John Hayner, Bridge Communities.
Tammy Presley, Northwestern Medicine.
Doris Kenny, DuPage Foundation.
Vanessa Roth, Outreach Community Ministries.
Catherine Nelson with the DuPage Federation.
Stephen Garlington, DuPage Regional Office of Education.
Katie Rush, Voice of Municipalities, I suppose.
Angela?
Angela Benson, Metropolitan Family Services.
Lourdes Lonergan, the Federation.
Marjorie Lou Brady, We Go Together for Kids.
Millie Rodriguez with Naperville Township and the DuPage County Caseworkers Association.
Janet Derrick, Lowe's and Fishes Community Services.
Jan Kay, the League of Women Voters of Illinois.
Laura Olson, United Way.
Kathleen Gregory, Access Community Health Network. Jenny Fabian with the People's Resource Center.
Espinosa, Department of Human Services, DuPage FCRC.
And Lisa Shavak, DuPage County Workforce Development Division.
All right, Kristen Hartsaw with the DuPage Federation.
Nadeen Israel, Everett Drive, Illinois.
Adam Porker with the DuPage County Health Department.
Carol Murphy with the DuPage Health Coalition.
And with that, we thought we'd start really slow and small, right? So our first meeting is going to focus on the state of healthcare because we thought, what could be easier than healthcare?
Very timely, very timely.
So now Candace is going to lead us through how the structure will work for today's meeting.
Thank you. See, I get the short piece on the agenda. So thank you all for being here. We are embarking on what I think is an exciting experiment, and I'm very pleased to be taking this journey with you. So today what we thought we would do is do a rip from the headlines, up to the minute, hot off the presses, look at healthcare from the federal, state, local level. And that'll take about an hour. And then we will take a very brief break, only if it's essential. I'm not a big believer in breaks because sometimes people sneak out the door. But I don't think that'll happen here. And then we are going to come back in small groups and talk about we're going to start with the easy question. And Marjorie Lou Brady has agreed to facilitate the small group discussions. The easy question is going to start with what's already happening. What are you already involved in to address the issues that you heard about from our panel of experts? And then we're going to get a little more difficult, and that will be what needs to happen in order to achieve one of our strategic goals, which is to ensure that everybody has access to the healthcare and human services that they need. So that's our task today. And then after we've done that for about an hour, Lourdes will close up and she'll talk about what we'll do for, as staff work behind the scenes after this meeting to try to operationalize what we identify as needed to be done. And then she's going to talk about the exciting similar meetings that we've got planned in January and April. So that's our, that is our plan for going forward. And Kristen has agreed to introduce and share the panel.
All right, well, thank you for being here this afternoon. Again, I'm Kristen Hartsaw with the Federation. You will get a copy of this presentation via email, and we've also printed 6 copies so that you have it as talking points to refer back to during the discussion portion. But you will have all of this content later. We've already done our introductions, but again, we have Nadeen Israel from EverThrive, Illinois. She is the Director of Policy, and she will give you an update on kind of the federal and state landscape, which seems to be changing every hour, if not more frequently. I will then talk a little bit about some of the upcoming changes to the Medicaid system with regards to managed care, and a little bit about the data system rollout that's coming soon. Adam Forker is with us from the Health Department. He's going to talk about some local efforts, Engage DuPage, as well as the preparation for the ACA Open Enrollment 5. And then Kara Murphy, president of DuPage Health Coalition, will give you some updates both about Access DuPage and something very exciting that we're looking forward to, the Dispensary of Hope. So that is our agenda for the afternoon, and without any further delay, I'll turn it over to Nadeen.
Alrighty. Thanks so much. Do I need that mic for you guys? Can you hear me? Okay. I've got this thing for the video, so I think we're good there. All right. Wonderful. Well, thank you so much for having me. I'm very excited. Again, my name is Nadeen Israel. I'm with EverThrive, Illinois. How are we doing here? Am I blocking you if I'm standing here? Okay, great. So I was joking with Kristen yesterday because I was in the office a little late, and I made a bunch of updates to the slides I had already sent to her and finalized, because that's how quick things are moving these days. Yeah, exactly. No, I'm not on Twitter. Thank God. So what I'm going to do briefly is go through kind of where we're at the federal level in terms of kind of what's going on in the healthcare world. A lot of this you all will know, but just to kind of make sure we're all on the same page. Do something similar with the state level, and then talk just very briefly about what we think is coming up next. So sort of where we're at is September 26th, which literally feels like, eons ago, on October 19th, but it was less than a month ago, and that's when the Graham-Cassidy bill essentially did not garner enough votes for it to be called on the Senate floor. So that was the latest ACA repeal bill, and that was the latest ACA repeal effort that we've seen from Congress. Since then, and a little bit even before that, a couple of months back, the Trump administration, we all knew that they were also going to try to sabotage and undermine the Affordable Care Act through the powers that they have as an executive branch. So sort of what's happened so far. There's actually two groups at the national level that have a great tracker if you haven't heard about it. So Center for Budget Policy Priorities and Families USA have a ACA like sabotage tracker. It chronicles, and that's where I pulled these from, some of these things, by date and what happened over the last year, kind of key moments or decisions made by the Trump administration to essentially sabotage the ACA. So I just pulled some of the key ones here for these next couple of slides. August 31st, so that's when the Trump administration announced it's going to slash funding for the navigators, right? And the outreach and enrollment piece. So all the commercials and the bus ads and all of that money that went into marketing to let people know about open enrollment and sort of when it is, what they should do about it, where to go, how to get free help, etc. So in Illinois, what that translated to is I think we have like 6 navigator groups or groups that got grants as a navigator group from the federal government, and 3 of them saw pretty huge cuts in their budget. I think somewhere between like 80 to 95%. The other 3 were still cut, but less so. And my understanding is of those that were cut, they're the ones they're the groups that serve outside of Chicago and Cook. So they basically serve the rest of the state. So that's something to keep in mind when we talk about this in terms of talking about the sabotage. The very groups that their funding was cut, and those are the groups that are supposed to provide free help for consumers, are not the groups that serve the Chicago area, which is what one might think. They're the groups that serve suburban and the collar and central and southern Illinois, essentially. Why that's also important is because we know that because of lots of different reasons in terms of resources and assistance, they're more sparse the further south that you go. So it's important that's another reason why that's important, why that's another devastating thing for the area of the state. September 22nd, so that's when we found out that consumers, in terms of the the application of when you would be able to go on healthcare.gov and actually apply, there's going to be, in terms of, they're calling it maintenance, right? Sort of technical assistance or maintenance that they're going to do to the website. But the healthcare.gov, the application or the website is going to be down every Sunday during the open enrollment period, except for one Sunday. Again, why that's another important thing to know about is because, 1, the weekend is when a lot of people would be applying. 2, Sunday, especially if you're thinking about faith groups and religious institutions or sort of gathering times, that would be a day when sisters would be out there in churches and other faith groups helping people apply and doing events like that. I apologize, I'm getting over a little thing. I do. Thank you. Let's see. October 6th is when the Trump administration started announcing, making decisions about more substantive pieces in terms of the actual coverage. So this was the decision that said employers can opt out of covering contraception based on moral or religious objection. In Illinois, luckily, we actually passed a bill 2 years ago, I believe, House Bill 5576. So it gives us some coverage around this, not fully. And we're still kind of digesting how this decision is going to impact Illinois, honestly. But it is something that will be critical in terms of access to contraceptive coverage for millions of women across the country, and potentially thousands in Illinois. We're still digesting, again, kind of the impact of this since it was so recent. What else? So October 12th is when President Trump signed the executive order essentially destabilizing the health insurance marketplace. There were a couple of things that happened, right? So he said, this is just an executive order, but allowing the sale of, they're calling them like association plans, but basically plans that are across state lines, that can be sold across state lines. And the second piece, which I'm blanking on right now, which is why I have my notes. Right, so beyond cost sharing reductions, the short-term plans. So basically allowing the sale of, so right now, I'm gonna back up for a second. Right now, insurance companies can sell what are called short-term health insurance plans, but in Illinois, my understanding is that they're limited to 3 months. But these plans don't have to comply by the ACA. So they don't have to cover essential health benefits and other kind of things that the ACA makes health insurance plans cover. These plans were originally meant for kind of people in between jobs, so that if you had a short stint of not having health insurance, you'd be able to buy a short-term plan and be covered in between jobs. So that was kind of the reason why these plans existed in the first place for decades. What the Trump administration said is that, through an executive order, is that if the state wants to, and if insurance companies want to, they can potentially have these plans, sell these plans, but beyond the 3 months, have them be 12 months plans. So depending on how this is executed, it depends on a lot of things. So it wouldn't be something that we would see right away. But depending on how it's executed, it could mean the sale of something like catastrophic plans come back again, even though we have the ACA in place. So again, something to kind of keep in mind in terms of the potential for sabotage. The big one, thank you, was the CSRs, right? The cost sharing reduction. So this was the money that the financial assistance that folks that are getting health insurance to the marketplace, right? But they're still basically working poor. And so just getting assistance with their premium is not going to be enough for them to have true access to their healthcare and health insurance. They will need help with out-of-pocket costs, deductibles, those kind of costs that come with utilizing healthcare. So that's what the CSRs are meant for. That's what they're used for. And that's what the Trump administration decided that it was no longer going to fund. In Illinois, I've seen numbers between, I think, 156,500 to 175,000 people in terms of how many people would be impacted by this decision to stop making the payments for the CSRs, for the cost sharing.
This would go to the health insurance company. And so that figure you just explained would be the people that would be impacted if the health insurance companies needed to raise their rates commensurate to what they were getting from the Fed.
Exactly. So that's actually kind of a nuanced but important piece to keep in mind, again, in terms of implementation for this piece. The payments right now, the cost sharing reductions, they actually don't go to the person. They go to the insurance company. So what this decision says, and what we know so far, is that those payments going to the health insurance company stop, but the actual person's sort of ability and right to receive a cost sharing reduction, that hasn't gone away. So what we don't know in terms of impact is what is that going to look like in depending on where this shakes us out over the next few months and over the year, what that's going to mean for next year, for next year's kind of plans. The other piece to this that's escaping me right now, maybe I'll come back to it if I remember. Okay, so what else is ahead of us when it comes to healthcare at the federal level? Most of us have probably heard about the deal that's been at least worked out by two people. Let's see. This is Alexander and Murray, thank you. 3 things in that are important, right? So what they're saying is that we'll fund, in that bill, we'll fund the CSRs for 2 years. So 2018 and 2019. So it's not a permanent funding of the cost sharing reductions, but for 2 years. We'll put some money back in for the Navigator grants. All that money that was cut, we'll put it back in. And the third thing, waiver changes, right. So the trade-off is we'll allow states to a little bit more flexibility when it comes to approving 1332 waivers. 1332 waivers were these waivers that were put as a part of the ACA that said, essentially, if a state wants to do things differently when it comes to running their health insurance marketplace than what the feds kind of have put out, they can, as long as they meet all these requirements. So that's what the waiving part is meant for. So this makes it the part of the compromise within this bill is that it would speed up and make some more concessions. The approval of 1332 waivers, and there's some more nuance to that, but that's kind of the general gist of but those are the 3 pieces. The CSRs for 2 years, the relaxing and a little bit more flexibility for states when it comes to 1332 waivers, and money for navigators, more money for the assisters. So let me just make sure there wasn't anything else I wanted to mention about this. Okay. I think where we're at with this is going back to the tweets. So Trump initially said that he was supportive. Then he tweeted the next, like within a few hours or that next morning, saying he wouldn't support anything that had money in it for the CSRs. And I believe most recently he said he is not supportive, and I believe Paul Ryan has said he's not supportive. So it's unclear where this is going to go. What we're hearing, my colleague is in DC right now, and what we're hearing is that it's not necessarily completely dead on arrival, this bill, but may not necessarily move on its own right this second. What we're excited about at EverThrive about this is that it's an effort at a bipartisan compromise for marketplace stabilization, because that's what is needed. So we're excited about that piece. We're still trying to understand the implications of what this bill will do and will mean for Illinois. CHIP funding expires, so there was a bunch of funding that was tied to the sort of the end of the federal fiscal year, which is September 30th. CHIP funding was one of them. So this is the Children's Health.
Explain what CHIP is.
Yes, so this is the Children's Health Insurance Program. We like to kind of describe it as a program, it's actually a block grant that sits on top of Medicaid. So it's really meant for the kids that are above the Medicaid, the thresholds, eligibility thresholds. In Illinois, we go up to like 318% of poverty altogether. We don't say CHIP and Medicaid in Illinois, we just say all kids. The program is just all kids. But underneath the all kids is Medicaid, and then there's CHIP. So again, I've seen different numbers for this, but it's about 250,000 kids that are on CHIP and Medicaid. So it's a large number of kids that would be impacted. Now, those kids aren't going to drop off, haven't dropped off yet. We still have some CHIP money that we can spend on continuing to insure these kids. But obviously that money will run out if the program isn't funded by Congress. The bipartisan deal, the community health center funding cliff, a couple other things, McV, which is the home visiting program. There's talk about bundling a lot of these issues together in a package deal when the federal budget runs out December 8th. So December 8th, the federal budget, we're only funded through December 8th at the federal level in terms of just the budget. So they need to do something to kind of continue funding for that. And what we're hearing is that a lot of these issues are going to be bundled in a bigger package when that deal comes about in a couple months or so. Community health center funding, so a similar thing. A lot of folks are familiar with this because we are or interact with community health centers. So there was a bill. A bill came out of the House and a bill came out of the Senate, separate bills. The House bill had that was extending funding for community health centers. The House bill, though, had the way it paid for it was by cutting a fund called the Prevention and Public Health Fund. That is actually like 12% of the CDC's budget. So it's a huge part of the CDC's budget. It pays for immunizations for kids. It pays for a lot of things. So it's kind of like robbing Peter to pay Paul. Not a good idea. Something we at EverThrive would not support. But that's how they kind of did it in the House version of the bill. The Senate version of the bill didn't do that. Passed kind of a clean version. But they also didn't say how they're going to pay for it, how they're going to pay for this extending the community health center funding. So again, that's stay tuned. That's what we know. At least that's what I know so far. And I talked a little bit about the federal budget. So all of this is happening at the same time. December 8th is kind of the date for the federal budget. And that's because they didn't pass a full year budget. Turns out Illinois is not the only one that doesn't do that. Let's see. So state level, we finally have a budget. So that's wonderful. While we knew that this wasn't going to kind of solve all of our problems, right, when it comes to our state budget, this was a huge step. We went over 2 years without a budget. We all felt the impact of it. Once you get the slides, I included just to make it easier, direct link to each of the budget bills. So there was budget package, the actual budget bill, the bill that implements it, which is SB 42, and then the revenue bill, the bill that pays for it, SB 9. And then how folks voted for it in the House and Senate. And we all know that Governor Rauner vetoed it, and the legislature and the House and Senate overrode that veto. So that's how it became law. So while the state budget was a huge step in the right direction, there were still significant cuts to the health and human service sector services within it, and the revenue raise wasn't enough to pay for all the unpaid bills. So I checked, and if I looked at the right thing, I think we're sitting at a little under $16 billion in unpaid bills right now. And that wasn't taken care of in the budget. So we still have a lot of work to do when it comes to needing revenue and using other means that we have to be able to get to a balanced budget. The thing that I wanted to mention that I learned yesterday was, or I read yesterday, some of you may have seen it already, is that the Rauner administration is actually saying that the fiscal year 18 budget is out of balance by $1.7 billion, right? So they've already said that they're gonna cut about 156 million, and they've identified where those are gonna be. Some of you, I think there was like the Senate Democrats put out or had a memo about this, so you should have it either in front of you or at your table. It tells you a little bit about why the numbers are off. So the Rauner administration is saying the fiscal year 18 budget is 1.7 billion out of balance. The General Assembly is saying there is actually a $300 million surplus in the fiscal year 18 budget. So obviously those are really far off, and so the memo gives a few reasons why that might be. Some of it is just based on revenue projections. So the Rauner administration is saying we're going to bring in this much in personal income tax, and the General Assembly said no, we're going to bring in probably this much. There's a couple other assumptions that are made. But the Rauner administration, the important thing to keep in mind is that the Rauner administration is making decisions right now based on their projection of 1.7 billion out of whack for this fiscal year that we're in right now. So we're not out of the woods when it comes to our budget, even for the fiscal year that we're in.
Well, and today he announced $89 million cut, $89 million in cuts to autism, addiction, I was just pulling it up.
Immigrant integration.
Homelessness is what it's actually this press release
indicated. Yeah, so exactly. So of that 156 million, they've said that they're going to cut to try to close the 1.7 billion gap. They've identified 156 million in cuts so far. Of that 156 million, 89 are coming from human services. $89 million of that 156 is coming from human services so far. And then that list is exactly what you said, and a bunch more. And one thing that I shared with a couple of folks internally yesterday is that if you're not on the list, don't think that you're sort of you're safe, because they're saying 1.7 billion and they've identified 156 million, and they're not talking about revenue. So advocacy is most definitely still needed. So again, what's ahead of us in terms of the state level, the fiscal year 19 budget? We've got a couple of things which I won't talk much about because my colleagues here are going to talk more about them. The implementation of expanded Medicaid managed care across the state. Officially, that starts at the Medicaid managed care RFP, January 1, 2018. IES, so that's an integrated eligibility system. Again, my colleague's going to talk more about that, but that goes live next week, which we're very excited about. I don't have anything more to share. I don't know if anybody else does on the 1115 behavioral health waiver. My understanding is that there's still negotiations going on between the feds and our state, and that's kind of the status of it. And then obviously, healthcare continues to change both at the federal and state level, which makes it really confusing to know what's going on for the average person. So where do we go from here? We have to keep pushing back at the federal level. There will continue to be attacks even if there isn't legislation. So we have to stay organized and continue to push back. A couple ways you can do that if you're not already plugged into this work. You can join EverThrive and sort of that you get our e-newsletters and all that good stuff. You can also, we worked with a bunch of organizations to start a coalition called Protect Our Care Illinois. The website is protectourcareil.org. EverThrive is everthriveil.org. So go to those websites, kind of check them out. You can sign up for e-news. It's the easiest way to kind of figure out what's going on because we do a lot of updates through those. We need to thank the folks that voted, right? So we've seen the kind of some of the implications of taking those votes for some of the legislators. So we need to thank them. We need to make sure that we're not always just kind of yelling at our elected officials when they're not doing what we would like them to do, but we also need to thank them and publicly and privately for passing a budget. The next thing ahead of us in terms of the state is kind of moving to a more fair tax. So a campaign or a movement to really make our state income tax a much more fair tax than it is currently. Currently, it's a flat tax. And obviously, we have to pay really close attention to the Medicaid managed care changes in terms of how they impact the people that we serve.